You're now live.
Good afternoon. Welcome to the Adults Health and Housing Cabinet Member meeting for Tuesday, 15th of November 2022. I'm Councillor Roy Webb, and with me I've got Kirsty McMillan and Julie Knight. Thank you. Any apologies?
No apologies.
No apologies. Any late items?
No late item.
Thank you. Any declarations of interest? Just note that I am the current chair of the Integrated Care Partnership, which it is not of pecuniary interest in this matter.
Noted.
Okay, and I've read the minutes of the meeting held on the 23rd of March, and I'll approve those as a true record. We then move on to item 5, which is the temporary variation to the adult social care charging policy on caring. So over to you, Julie.
Okay, thank you. So we just want to bring to your attention the fact that CareLink has the opportunity to undertake a pilot on a forced response service in the city, which is something which is initiated by the integrated care system. So we would like your decision on approval of a temporary variation on the City Council's charging policy so that CareLink can undertake this pilot. And to support that, you will also ask to approve the repurposing of a portion of Ageing Well Fund monies, which were originally intended for a wider sort of step-up service that we are also delivering to specifically support the forced recovery service delivered by CareLink. There is another pilot in the county which is run by Chesterfield on a similar basis. So to support that, you are asked to approve the CareLink service is one of the 2 countywide pilots, and this is all supported by community urgent response developments within the integrated care system, and also has to approve details of the customer cohort which will receive the CareLink service under the temporary variation. So particular aspects to note on this, I'd like you to note the exit strategy for the temporary variation, which will finish on the 31st of March 2023. So the forced response service is a priority of the Ageing Well sort of strategy, and it's a national priority for community urgent response. The specific intention of the forced response service is that CareLink would extend from supporting only those people who are individually contracted to the CareLink service and pay for that service to the council as per the charging policy, to a new cohort of people who do not currently receive the CareLink service. They are residents of Derby City, but who are screened as non-injured fallers by EMAS, and that they will then be referred into CareLink via a new screening service which has been initiated as part of the integrated care system, community urgent response, and then streamed through to CareLink for the specific purpose of lifting the non-injured fallers who are not on the CareLink service. So they've already been medically screened as non-injured, so that in terms of sort of supporting CareLink, that gives that sort of assurance that these people do not need medical attention. So the new response service, the temporary response service, would then go out to lift the fallers. There is also the potential for the installation of equipment to prevent further falls, which is part of the funding that we've achieved. And then potentially to receive, and if they do need that equipment or consent to it, then there would be a free period of monitoring this, on these current care link sort of parameters to see, you know, if they are sort of if that will benefit them in terms of preventing further falls. At the end of that free period, they then have the opportunity, as if they so wish, to convert to become paying customers, or the equipment will be removed and that will cease. So there is a potential here for people to benefit longer term from CareLink as part of this pilot. So the existing CareLink customers will continue to receive their paid for service in exactly the same way as they do at the moment. Then we've had the funding includes the provision of additional temporary staffing to support this pilot. In the early stages, at least, the thing we're asking you to improve, they will only be working daytime hours. This is not it's not a 24/7 service initially, because it's a pilot. A lot of the purpose of this is to collect information and data on whether this is something going forward which the integrated care system would want to look at as a permanent arrangement. But in the early stage, this is just a pilot. So that one of the things which the temporary responders will be doing is sort of testing that out. We have some modelling on numbers, but really until we start, we don't know the demand for this service, and that will be part of what the pilot will be determined for us. So really, those are the recommendations that you sort of approve this pilot on the basis that I've described, and to sort of give you assurance that it is a pilot. It will cease on the 31st of March, unless there is, and if there is sort of a further initiative, then obviously that would come forward for consideration, and that there will be no impact on the current customers, and also there is potential benefit to a wider network of people in Derby City. And one of the things which has come to light last week really is that the new responders are being offered training on such of enhanced training in terms of understanding some observations, clinical observations, and it will give them a greater assurance really when they go into lift a faller, that they really understand what they're seeing, and they can feed that information back to the screening service. And we're also being offered that training for the whole of our staff group too, which will be a great benefit to CareLink overall. So I think really that's probably summarises.
There's a flow chart of sorts as the appendix, and you can see that, which really helps, I think, to show when this service would respond and when it wouldn't do, and also how it fits in, with the wider approach. It is very detailed, but I think anything to do with EMAS and sort of 999 calls tends to be very heavily prescribed, doesn't it? So there's lots of routes in and out. So this is quite helpful in a way of showing the flow of individuals. But obviously from our staffing point of view, we want to support this with lots of protocols. And
I think as well, what is really helpful is that now we have our community urgent response screening point in the city, which is jointly staffed by the community health services and social care. We have an escalation route back into there if the CareLink responders do sort of find that when they get to a property, the faller is more, seemingly more sort of injured or more ill than the screening suggested. And that again is also a benefit now for all of our CareLink responders. We have that routine. So developing this pilot has actually really improved the communication with CareLink and its position in the health and social care system.
So, right, few questions from me then. Are EMAS part of this pilot?
Yes.
And are they making any contribution to this? Are we assessing what impact it has on EMAS as part of this pilot? Because if we're managing to help people that have fallen and adding new technology freely to them, then the benefit to health would be on EMAS and possibly accident and emergency at the hospital.
Ultimately on all of the health and social care providers, because potentially a lot of the people who come through our first system, for instance, on discharge, were admitted to hospital fear of fall in the first place. So in a way, this is actually, it's helping people to stay at home. It's helping to sort of prevent an avoidable admission. And in terms of the benefits, this is NHS funding, and it is specifically to look at how we can enable people to live safer lives at home and not end up in hospital as a result of a fall. So that's why this is a pilot, really, to look at where the benefits are.
I don't know whether EMAS are also receiving funding. I don't know whether you know, Julie, but they're certainly designed in the pathway.
Yes.
But I don't know whether they're getting any additional funding. This is all coming out of the Ageing Well funding, which is nationally driven. So they may well be getting funding for a variety of initiatives.
And I think what this is around is ensuring that they aren't called out, because often people who fall are seen as low priority and they end up being on the floor for hours and hours and hours. And this is just those give a better experience to people who aren't injured, but also to enable the EMAS resources to be focused on those who are in most need, because at the moment that is not, that they're really struggling.
And it should have an impact on safeguarding referral.
Hopefully.
Yes.
Hopefully, because I think what's happened in the past is, as Julie said, by the time EMAS get there, 6, 7, 8, 9 hours can sadly have passed. So therefore the condition of the person has deteriorated, and that in turn, rightly or wrongly, drives EMAS to kind of raise safety concerns. But it's in part because the pressure on them means they haven't responded. So it's a benefit all round, but the learning is what we're trying to capture through the pilot.
Okay. I noted 2.1 that the temporary variation is at 53. I think that should be 5.3.
Yeah, I noticed
yes.
that. The dot jumped.
The dot move.
Okay. You've got 3 recommendations here for me. I can accept the temporary variation at 3.1 until March 2023, and the associated bullet points on there. Again, with varying the adult social care charging policy at 3.2 for this pilot, so there will be no charging for anybody on this scheme for the first 12 weeks. So I can accept that one, and that runs into 3.3. So after the 12-week period, then the equipment will be moved, or the customer can opt for the charge to keep caring.
Yeah.
So I'm happy to accept all 3 of those. I would like to have a report back, preferably in before the variation ends on the 31st of March.
Early March.
Maybe early March, so that we can pick up the benefits and if there are any issues around this, and do something that may or may not be required to keep this service going. So
Thank you.
that's all 3 recommendations, and thank you very much indeed.